Okay, good morning and welcome to today's resiliency call, Access to Broadband for Telehealth with Oregon Representative Pam Marsh. TAO is excited to continue our conversation around resiliency with this special 5-part series on digital health. It'll be running Tuesday mornings at 8:30 through the month of June. I'm Riley O'Brien, Vice President of Events and Experiences at TAO, and I'm joined by Ruthie Ditzler, TAO's Marketing and Regional Programs Coordinator, who's providing back-end Zoom support. A couple of rules of engagement before we start. All participants have been muted. Please remain on mute unless a TAO staff member unmutes you and calls on you to talk. You can ask or respond to questions in the chat box publicly or privately by directing your message to either Ruthie or I, and we'll monitor the chat box and respond throughout the discussion. We ask you all to also engage using the participant icon on your screen. Please engage with us on social media during this call and throughout the day. We'd love to share what's happening at TAO and get participant takeaways from our events. And due to limited time with this half-an-hour call, we'll be capturing all the questions in the chat and shift any unanswered questions to Mobilize. Mobilize is our member-only virtual community, and we'll post unanswered questions there to keep the conversation going after the event. If you have any questions about joining Mobilize, please reach out to Justin Martinez on our team, whose email is on the screen. And if you have any questions about joining TAO, please reach out to membership@techoregon.org. In partnership with Free Geek, the business community is uniting to host Tech Now, a series of contactless drive-through technology collection sites across Portland metro region, over a 2-week period that has started on May 27th. We encourage you to share the campaign with your employees, customers, and the general community because we have an ambitious goal to collect 10,000 devices through both technology and financial contributions, as current estimates show that more than 75,000 computers are needed by students across Oregon to support distance learning. If you have any questions, you can go to Free Geek's website for more information. We invite you to join us tomorrow morning at 8:30 for our next resiliency session with Oregon Senator Arnie Roblon, co-chair of the Oregon Legislative Joint Committee on Coronavirus Response. A huge thank you goes out to OCHIN for underwriting this series. We appreciate their sponsorship and are excited to explore topics related to digital health. And finally, it's my pleasure to introduce Oregon Representative Pam Marsh and OCHIN's Executive Vice President of Government Relations and Public Affairs, Jennifer Stoll. Jen and Pam, the floor is yours.
Thank you.
Thank you, Rayleigh. And thank you for the Tech Association for hosting this series of webinars. Today, we're very, very lucky to have Representative Pam Marsh with us. Representative Marsh has been a crusader for broadband access in Oregon for many years, having dealt with a personal challenge of lack of access to broadband in her community. She's really taken the leadership role in the legislature on driving broadband access. And today we are lucky to have her share with us her learning, but also thinking about how we could collaborate with her on broadband expansion in the state of Oregon and beyond, really. Thinking about how to be able to build broadband in communities. So getting started, I'll have a series of about 5 questions that we would like to ask Representative Marsh, but please, as you have questions, enter them in the chat box, and our intention is to be able to get to your questions in the latter part of the conversation with Representative Marsh. Okay, so Representative Marsh, again, thank you for being a champion for broadband access throughout Oregon, both urban and rural. And I was wondering if you could start, this is a resiliency conversation. I was wondering if you could start about how we've been championing broadband now for quite some time, and COVID has hit. What lessons have you learned from COVID, and has it shaped any of your current thinking around broadband access?
Thank you, Jennifer, and thank you to the Tech Association for putting on these events. It's great to be here this morning. I think the main issue that we're looking at out of COVID is, frankly, momentum. All of a sudden, the world understands the issues that we've been talking about. And we're looking at broadband as not only being critical to business and education and healthcare and communication and community organizing, but it's also a key tool in our emergency response. So we have momentum, and the question for all of us who have been passionate advocates of this issue in the past is, how do we take advantage of the moment in time? Because clearly we know that being vital as it is a far different issue than being accessible. We know that Oregonians all over the state lack access even at this critical moment. Some of that is due to lack of infrastructure. Some of that is due to affordability issues. Some of it is due to lack of the skill sets that they need to access and use technology. The result is probably 400,000 Oregonians don't have access to infrastructure. And that number is likely much larger because mapping and being able to really clearly indicate where the gaps are is one of the problems that we face. And we know that Oregonians all over the state lack the high-speed internet that they're going to need both now and in the future. 40% of rural Oregonians have access to services that are more than 25.3, which is the FCC standard service requirement for residential use. And 60%, only 60% of urban residents have access to that kind of internet. So all kinds of gaps. We've got momentum. How do we take advantage of it?
Great, thank you.
Mm-hmm.
So the momentum is a really great thing to talk about. So tell us a little bit more about your current goals in expanding access to broadband in the state, and how are we going to take advantage of some of this momentum?
Well, I think we need to be looking at both short and long-term goals right now. Short term is the rest of the pandemic. What are we going to do to make sure that healthcare is available to people in our most rural, most remote corners of the state? What are we going to do to make sure that students in households all over the state have access to technology? I think it has been a shock to many people who haven't focused on this issue to understand that even in our most urban core, schools are printing out packets and having them delivered by school buses to children who have no hope of getting on the internet. We have, across the state, we have more than 50 schools that don't have adequate access to the internet. So how the heck would the students who are not sitting in the schools, who are sitting right now in much more remote locations with their families, ever have access to the internet? So the question is, what do we do in the short term? And that is, we use whatever funding comes forward to us, and we collect computers, just as discussed in the top of this half an hour. And we try to get hotspots out to students and families so that they have access. On the longer term, we need to be lining up partners, and some of them will be new partners that can help us look at this work in the future. Our economic development districts across the state haven't traditionally been involved in broadband, but all of a sudden, they understand that this is an issue that's in front of them. I think we have new attention from business and industry. So we got to line up those partners, and we got to be prepared to leverage whatever federal funding comes forward to us in the form of longer term infrastructure bills, so that we are really ready to take best advantage of that. So there is definitely work in the short term and in the long term to get us ready and actually solve this digital divide once and for all.
Great. I'm going to come back to funding in a second, but I wanted to talk about mapping a little bit. Get your perspective on, when you talk about mapping, if you could explain that a little bit more, and your current thinking around the FCC maps, and also the maps that are being used to explain what our current connectivity levels are throughout the state.
Well, the maps that traditionally have been used by the FCC are census tract based, which means that if a provider, a vendor, can indicate that a single point in a census tract is being served by 25.3 or whatever the current standard is, then that census tract is checked off as having broadband. Of course, we know that that is no indication of the availability of services throughout the census tracts. And certainly in rural Oregon, we have some census tracts that go for miles and miles and miles. So to indicate that one point in that tract is served is simply, it really doesn't serve to give us any kind of good data to move forward on. So that's just the infrastructure questions. Then there is the actual accessibility questions, which are not particularly collected by the FCC. We know in the heart of Portland that you may have services available, But if families can't access those services, and certainly our lower income families are the ones who are hardest hit by that. We know that 44% of people with household incomes under $30,000 do not have access to internet services, regardless of whether they are available. Then we've got a significant problem. So we are starting to use different kinds of strategies. Some of it is reporting out by individuals who are have their own service in their community, simply reporting in to create a database of what's out there on the ground. But of course, if you don't have internet, you're not reporting in to the homegrown database. So a lot of work still has to happen in terms of our ability to understand who's online and who's left out.
Thank you for that. So I do want to talk a little bit about your thoughts around broadband. You mentioned underserved communities, and one of the things that OCHIN has observed, at least when it comes to healthcare access and digital health equity, is that when patients don't have access to digital health or affordability becomes a problem, it really becomes a social determinant of health. What are your thoughts on that as kind of a theory or as a concept? And what are your thoughts on some programs that we might be able to implement to bridge some of those gaps?
Well, first of all, I think it's a tremendous breakthrough to start understanding that access to technology is one of those fundamental building blocks that we need to maintain health. And I think the pandemic, frankly, has made that all the more clear, because if you can't get access to healthcare, if your kids can't get the school lessons that they need, obviously you're left behind. So developing and starting to look at this as being as fundamental as access to electricity, as fundamental to the provision of housing, I think is really moving us in a step where we'll be prepared to actually address the issue. And a lot of that is going to hinge after we resolve the infrastructure questions, which will happen. It's a matter of designing projects, putting them on the ground, and having enough money to actually construct them. Then we are going to have to look at the affordability question and the digital divide that's really created because people can't get access to technology. I think one of our jobs will be to develop an ongoing source of support, of subsidy for services, much like we provide for energy efficiency within the state. We have to recognize that helping people pay their internet bills is a legitimate public policy.
Thank you for that. So let's talk about state and federal funding. And this is where the Tech Association and our members can help support you. Let's talk about federal subsidies and federal dollars. What are you looking at currently federally, and what policies are you trying to encourage our federal delegation to advocate in behalf of to help support this work?
Well, again, it's a little bit of a short-term and long-term look. The feds have put money through the CARES Act, one of their pieces of legislation, into both some direct internet support. And we've had, OCHIN has been one of those who have really initiated efforts to try to bring some of that money to Oregon so that we can get hotspots and services out to people. That's the short term. State also has some access to some short term monies that we are looking at that have to be spent by the end of the year. So we're looking at that money and saying, can we get some of that money to put into broadband? And if so, how do we best spend it to get people online so that we're actually impacting the gaps we are seeing by the end of the year? And then there is the long-term question. And we're also still sitting around waiting to see if our friends at the federal level will invest money into an infrastructure bill, including one that addresses broadband. I think the chances of that are pretty good because, again, this issue is front and center, and we understand it's a rural and an urban issue across the country. When that happens, we are advocating for federal dollars that come to us to have some flexibility. It would be great to have some block grant funding that we could put into our state broadband office so that we can make sure that we have the institutional capacity to actually put projects together, to coordinate providers within communities, to develop projects that best fit the needs in an individual community and the providers that are there and the kinds of technology that's most appropriate. And that's going to take some upfront money, and it's going to be hard for the state to come up with that. So if the federal money is flexible, then we'll actually have an opportunity to build capacity so that we're in the best position to leverage down the line. So we're really advocating for the feds to look at some flexibility and then to put money into infrastructure that we can direct to the benefit of communities.
So you mentioned a little bit about the state budgets being challenging. You know, what do you think will be some of the best ways that we can help message and overcome some of those challenges to build out, to support broadband work?
Well, I think this is the moment, first of all, to talk about it, because we are all confronted with the gaps that were always there, but are much more obvious during a pandemic. And this is the obvious gaps. It's students who can't get online, and it's the also other kinds of gaps. It's business people or people who work for state agencies or people who work or who are now called upon to work from home, who struggle, frankly, to get on a Zoom meeting, even though they don't live that far from the I-5 corridor. So we're recognizing that this is core to everything that we do. Our patterns are going to continue to reflect patterns established in the pandemic as we move forward, and they are going to require that we have technology. So talk about it, document what the issues are, and then engage elected officials from the local to the state to the federal level in understanding that you believe that this should be a priority for funding as it comes forward.
Thank you. Thank you for that. Rayleigh, I want to go to the chat. Are there any questions in the chat at this point?
I do have some questions that were submitted in advance for the representative. Great. The first question is, are you aware of any similar activity in Washington or any formal analysis of the extent of need in Washington and Oregon?
You know that Washington established a broadband office about a year and a half ago, probably just before Oregon did. Oregon established our office about a year and a half ago by executive order, and then we passed legislation to place it into statute. I think Oregon may be, frankly, ahead of us in terms of putting money into broadband. I think, although I'm not an expert at all of what they're doing up there, I think they put about 25 million into broadband last year. We are still looking for funding in our state. Having the office is one great step forward. Establishing an ongoing source of funding to put into telecommunications for both those subsidies and for infrastructure is frankly our big gap here in Oregon. And not relevant to the question, but let me just make a pitch for a specific piece of legislation that we've been working on for a couple of years that will modernize the Universal Service Fund. Not to go into the weeds, but basically that's a telecommunications fund now paid by landlines. If we can get all providers into that fund, that should serve in the future as our means for basic telecommunications funding. So that's on our still to-do list here in Oregon.
Great. And the second question I have is, what types of care are being most squeezed by the lack of broadband? And are these addressed effectively by telehealth?
That might be a question actually for Jen, because you're working actually in the field of healthcare and may be more prepared to address specific applications.
Yeah, sure. So one of the programs that that OCHIN has been actively advocating to support is the expansion of the Rural Health Care Fund. It's one of the programs that are administered under the FCC to support affordable broadband for healthcare providers in rural and underserved urban areas. And the program has been oversubscribed. It was established in 2007, but vastly underfunded over the last few years. And so there are several pieces of legislation moving through Congress. One is a bill by Anna Eshoo out of California and Don Young out of Alaska to put another $2 billion into this fund. So there are a lot of different efforts congressionally right now, as Representative March talked about. There's a lot of momentum to expand access to broadband for healthcare. There's also other programs to help organizations get access to equipment and subsidized broadband for patients as well as their providers, and that were passed in the CARES Act. So there have been efforts to help support this work. And I don't know if that answered the question, Rayleigh, but that's what we're focused on anyhow, is how do we pull those subsidies down for the healthcare providers that need it in the communities in Oregon and beyond? And also, how do we help them find affordable technology equipment so that patients can participate and that there isn't a digital divide when it comes to healthcare? We're definitely seeing that many underserved patients don't have access to smartphones, and so they're on flip phones. Many underserved or lower income patients also don't want to use their prepaid minutes to access telehealth for those services as well. So we want to make sure that there are no inequities in being able to participate in telehealth platforms, because we are seeing tremendously great innovation in that space. The healthcare community it's pretty amazing how the healthcare community in the state of Oregon and beyond have essentially innovated their entire business model in 90 days. It's really outstanding. Most providers have gone from fully in-person visits to fully virtual, even with reimbursement and security and inconsistencies on various payers. So we're very lucky as a community that we are highly digitized.
And the last question from that.
Sorry, go ahead.
Apologize for that. The last question from that same individual is, do you see any supply side constraints in telehealth?
Supply side constraints. I don't know if I fully understand the question. I'm not quite sure I completely understand it as well, but that was the question that was asked. So we can move on from there.
I'd like to just throw in one addition to what Jen just said, which is, I think, one of our goals in the future has to make sure that we maintain telehealth pay equity among, to ensure that services are paid fairly. Because what we're finding is, as Jen said, not only have our providers jump to this and integrate it into their practices, we're the initial input from patients is very positive. We're seeing mental health appointments well attended, because it turns out if you're stuck in a parking lot waiting for your kid, you can still go to your appointment if you can do it on your phone. And the folks who are providing those services often are reporting that it feels like a more intimate, a more successful event. So we got to make sure that we continue to provide equity in the payment schedules for those kinds of services to ensure that they remain a significant part of the healthcare provision.
That was the last question we had from current participants and those who had submitted questions prior to this event. If you're open for it, Representative Marsh, we're going to be putting this up on our Mobilize community. And if you're welcome to, or if we can, we would love to welcome questions from that community and forward them along to your team to provide answers for them. Great,
that'd be super. We'd love to hear from people. And again, we encourage people who are passionate about this to reach out and to make it clear to their elected officials that every level of government needs to engage in this subject.
Great. Thank you, Representative. That was my last question. How can we support and what can we do to support expansion of broadband in our communities? And I think that's a very nicely way to say everyone needs to be engaged, and broadband is a community effort. Would you agree?
Absolutely, totally. From the community up through the federal level, we are all partners in putting together this network.
Wonderful, thank you. That's all I have, Rayleigh.
Thank you both so very much for participating with us this morning. We encourage everyone who's on this call right now to sign up for our next Resiliency Series event tomorrow morning. And next week, we'll be hosting Representative Rachel Pruzak with Jen Stoll to talk more about payments for telehealth. So if you would like to join us, please check out techoregon.org /events. Thank you both again, and I hope you have a wonderful Tuesday.
Thank you. Thank you so much.
Thank you.